Hi, my name is Vivi Stutz. I'm a licensed mental health counselor and I work in my private practice, Phoenix Rises Counseling. And I am on a mission to bring you as much information and resources about trauma as I possibly can so that you can detect and heal your own trauma and heal trauma one person at a time. Today, I want to talk about different signs of trauma that are hard to miss. I'm actually going to start with a sign of trauma that is not hard to miss at all because I forgot it in my last video. And I feel so mad about it, but I already posted it and it got views and it got comments. And so I don't want to take it down. But I will post the link to my website underneath this video again. And you can download the self-screening tool for trauma. And it's there. Sexual trauma. Obviously, that should have been in my trauma screen video, but it's on the printed version that you can get for free. And again, I will not take your email address. It doesn't work for therapists at all. I will not haunt you, bombard you with emails, and I don't take prisoners. So I promise it's for free. So what I should have asked in the last video and screened for is sexual trauma. Has anyone ever forced you to engage in intercourse or oral sex? Or has anyone touched you or made you touch them as a child or as an adult? Or has anyone made sexual comments to you as a child or as an adult? The kind of thing that we today know as sexual harassment, usually in the workplace. But it can happen to children, teenagers too, and it can be very, very scary when we're younger. Or do you remember playing sexual games as a child that were age inappropriate? So as an example, imagine 5-year-olds that are playing out sexual acts and you watch that and you think, if they somehow successfully bypass the parental control and watch things on the internet they shouldn't have been watching, that kind of thing. Do you remember that happening in your own life? That can indicate that sexual abuse has happened to you, but you don't remember it. Because children, when something strange happens to them, they might not know that it's wrong. They might get scared. They might feel uncomfortable. They might try to make sense of it. So if they start to play out sexual acts, we as therapists, we start to look for, well, what's happening in their environment and how can we protect them. But if you remember something like that in your own life, just consider that maybe there could have been sexual abuse in your past that causes symptoms today, but you might not even be able to remember it unless you work with a professional therapist. And another sign of sexual trauma that is surprisingly difficult to detect, at least it seems that way, is difficulty engaging sexually. So I often have clients come into my practice and talk about it. I find it very difficult to have sex with my partner. I don't know why I'm like that. I love this person. I want to get close, and I don't like it, and I don't know why, and I'm not enjoying it. Or strong emotions during sex, and that can really freak a person out too. So a client might say, my partner is touching me the wrong way or in the wrong place. I freak out and I just want to throw them out of bed and scream at them to leave, and I feel really crazy and I have these strong emotions and I don't know what's going on with me and I must be crazy. There must be something wrong with me. And that's usually not the case. The partner's touch or anything during sex can trigger a memory of sexual abuse, again, that you might or might not remember consciously, might be kind of in the back of your head, stuffed away, but it triggers that memory. The amygdala fires, you have these really strong emotions, or you just feel uncomfortable, or you think you don't want to have sex, you don't like it. But that's probably not how you're born or made. That's a sign that there's a good chance that there was sexual trauma, and again, you may or may not remember it. Another sign of sexual trauma is mentally going away during sex. And I'm not talking necessarily about fantasizing that may go on during sex. Even though, when I'm really picky, I would maybe ask a few questions of a client. Like, if you're not mentally present with your partner while you are engaging sexually, well, why are you not there with that person? What is going on for you? If you go somewhere else mentally, and sometimes maybe you need that to feel turned on, that's okay. But if you notice that you go somewhere else mentally, you might have a reason why you're going away, why you can't be physically present in your body. Another thing is you could go away emotionally, that you just go numb, you don't feel anything. Or physically, that you kind of go through it mechanically, but you're kind of numb. You're not fully there. You're not fully in your body. You're actually somewhere else, or you shut down, you feel nothing, and you might even think like, well, sex, I guess a lot of people say it's fun. It's not fun for me. I don't enjoy it that much. And you literally feel nothing, or very little, or you don't feel pleasure. And I know women used to be blamed for that a lot. So you don't enjoy sex. Well, there might be a reason why. Because something traumatic happened sexually, and the person learned to dissociate, had to dissociate in that moment, like mentally go away. And so every time the person engages in sex, the trauma is triggered, might not be conscious, and the person goes away mentally, and then of course can enjoy the interaction. So if that's happening for you, check in mentally, see if it resonates for you. If you have a sense that there's something in there for you, please seek professional help. It can be healed. Another one is just avoidance of sex altogether, having headaches, not feeling like it, being too tired. And of course there can be many relationship problems, and that one I see more often in women. I also, in the LGBTQ community, I also see it in men though sometimes, but not quite as often. Just avoidance of sex. There can be something in the relationship where the partner is actually traumatizing in the now. And so then, of course, we don't feel like sexually engaging. But it can also be that it might be not comfortable in the relationship, and the intimacy and the safety is missing. But it also just triggers all these very confusing emotions. And of course, then we don't want to deal with it because we don't know what it is. And usually we feel crazy. We're like, there's something wrong with us. So please get help if you notice that happening inside of yourself. And don't ever tell yourself that there's crazy, that you're broken, or that there's something wrong with you. There's always a reason for something that is going on inside of you, and it deserves to be honored. If something is hurt, wounds can be healed. The next sign of potential sexual trauma is being uncomfortable, being touched by a stranger or family. And now that can also be a sign of violent trauma. So that somebody hit you, kicked you, pushed you, and so you don't want to be touched. But very often I find, just from experience and working a lot with sexual trauma, is that if somebody doesn't like to be touched, especially not suddenly, there very often seems to be sexual trauma present. Again, sexual trauma or violent trauma. So if you're experiencing that sign of trauma, Another one that could also be sexual trauma or violent trauma is anxiety when someone gets into your personal space, especially too quickly or without permission. You know, like the uncle that grabbed you as a small child and just kissed you and hugged you, and you didn't see them for 3 years straight, and you're like, what the hell? And you got freaked out and like, why are you getting in my space like this? But we can have that as an adult too. Like, don't get into my space, don't come too close unless you have permission. And if that brings up strong emotions for you, or you're like, I just don't like it, it's interesting to ask, well, why is it that you don't like it? What does it bring up for you? Could be sexual trauma or violent trauma. And you're very, very protective of your space. But it does make relationships difficult because of the strong feelings that come up, or maybe rules that you have, that you try to tell your partner can't make sense of it, you can't make sense of it, and then you might be labeled as, oh, too difficult, when really there's just trauma present and you haven't detected it and you haven't healed it yet. So this is it for sexual trauma. If you still have patience, and I hope so, I have many signs of hidden traumas or hard to detect traumas. Another one is mental blanks. I also like to call it the brain freeze. And the way it looks like in my practice when clients come in is, I had a really good childhood, I just don't remember much of it. And when I hear that, or when therapists hear that, we go, oh, it's one of these moments, like, oh, you had a good childhood, but you don't remember it. Well, there's the reason why you don't remember it. It's because you had to mentally go away or shut away the entire memory just to be able to get through it. So the mental blanks that are times in your life that you can't remember, they're a sign of trauma. I can give you a personal example. When I was 3 years old, I was climbing a tower in a playground, and a piece of rust fell into my left eye. And I remember running to my mother and crying, and then I went blank. And the next thing I remember literally is being at an eye doctor's, looking in my eye to see if the surgery of removing the piece of rust, if that was successful. But I have this mental blank. I cannot access any of the memories in between. So obviously something traumatic happened to me. I was 3 years old, so maybe my mother got really upset and she was worried that I was injured or I would lose my eye, and maybe she reacted loudly and it scared me so much. I thought that I did something bad or did something wrong, and so that was so traumatizing to me that I can't access this period of time. But it just lets us know that there's a trauma present. Something traumatic happened, and there's a kind of retroactive amnesia. Even though I'm going to not throw psychobabble at you. I'm misusing this term possibly, but I don't want to do that. So I want to speak in English that everyone can understand. But so these mental blanks, I had a good childhood, I just don't remember it. Or shorter ones, where you don't remember, maybe a weekend, you don't remember certain events, or let's say you weren't drunk or intoxicated, that's why you don't remember it. Or mental gaps, no memory, maybe during stressful times in your family in the past as a child, or during any time of your life. It can be an accident, disease, a time in a hospital, just scary times, and you find that you can't remember them. That's a hidden sign of trauma. And it's just, if you know that this is happening, or you notice it and you're aware of, like, oh yeah, there are times that really, for some reason, like, they're almost like cut out. There's a reason for that. Your brain shut away, your brain shut down to protect you from having to experience the scary time fully. And it's locked away, but it's stored in the amygdala, and it will trigger strong feelings. So it's better if you go and heal it. Just like you have a broken leg and, you've been limping for a long time. It would be a good idea to fix it and set it so you don't have to limp anymore. Another sign of trauma, and I think this is more obvious, but not everyone knows it. Flashbacks. I think we probably have all heard of flashbacks, and then flashbacks are a sign of post-traumatic stress disorder, but they can be so subtle that they're hard to detect. And also, really want to talk to everybody who doesn't know much about trauma and maybe learns something new here. So flashbacks are moments where an unwanted thought, feeling, or usually memory comes in, or a memory can even be so vivid as if it's happening right now, as if you're put back in time and you're reliving something, as if it's happening in the now, and usually connected with scary traumatic events. Again, I can give you a personal example, and I prefer personal examples. Sometimes I use client examples, but I'm very protective over my clients' privacy, of course. So if I can come up with one of my own, I'll give you mine. So as an example of a flashback, I once landed at Frankfurt Airport. I landed in Germany, and I hadn't been there for a very, very long time. And just upon landing, the gray weather triggered a flood of memory, and they were so real. Scary things that happened in Germany, they were so real as if I was experiencing them in the moment. Or another example of a flashback, I inherited my mother's apartment, and I had to change it completely so that it couldn't be recognized, because I was walking through that apartment, and I looked at the kitchen floor and the yellow tiles, and the yellow tiles brought back memories that were so vivid that I saw the apartment the way it used to look. I put in white doors, I saw the brown doors, I expected someone to be behind it, and I expected events that did happen at some point. But the memory was so real, as if I had actually time traveled. Very, very upsetting and disturbing. So these are flashbacks. Another great example is Bessel van der Kolk writes about it in The Body Keeps the Score. I love that example. I think I brought it up in another video, where a war veteran had a meltdown every Thursday morning, didn't know why, worked with a therapist, and then found out that on Thursday mornings, the neighbors put out their trash bags wrapped up next to the trash cans for pickup. And for him, unconsciously, it triggered the memory of body bags during wartime. And so he had a meltdown, didn't know why, and really he was seeing the trash bags, and he was experiencing a flashback. In this case, probably not a very conscious one. You're not reliving a memory as if it's happening in the now, because then we know what we're experiencing. But he had a flashback with very, very strong emotions. These are also flashbacks. Another sign of trauma that's hard to spot is nightmares. And I mean, we all have nightmares at times, and usually it's our brain trying to process memories that were difficult, or the brain is trying to sort out memories. That's actually similar to how EMDR works. But I'm talking about the kind of nightmares that happen very often, or after scary traumatic events. And there could be a replaying event, so you dream the whole sequence over and over, or recurring themes, like a symbolic nightmare that you might have had your whole life. And in that case, I'm going to give an example of a client. It was a recurring theme of trying to swim to the shore, trying to escape a shark, but never quite reaching the shore, never quite being sure if the shark would get them, and then waking up. It was terrifying. We did emdr, and we were able to identify the traumas. We worked the traumas out of their system, and then the nightmare changed. Actually, it became a positive dream, and that often happens with emdr. But the dream changed into being able to get away from the shark, swim faster, and reaching the shore and getting away. So that's a sign of the trauma being resolved, but just the recurring theme of the nightmare, trying to get away from something and not being able to, or not being sure, that's a sign of trauma as well. It plays out symbolically in your brain, and your brain is trying to make sense of it just in the best way it has available. And there's most likely a memory stuck, and you can't process it. That's why the dream keeps showing up. And again, with professional help, you can work through and resolve the traumatic event, and the dream will change or stop. When it happens in therapy, I'm besides myself with excitement, because that kind of healing is so beautiful. But nightmares, so please watch out for them. Okay, the next one, let's see if I can get my technology to work here. I work very hard on improving sound quality and camera quality. I hope you notice that, and I hope it's going to get even better. But I want to talk about dissociation, and I think that's we might know about that dissociation is a sign of trauma, and we don't know enough about it, or we don't understand enough to actually spot it in ourselves. So dissociation is a kind of mentally, emotionally going away. And it can be mentally going away in conflict. I've had that in a couple. They came in, one partner was saying, well, the other partner, well, actually, she was saying that he's never listening in conflict. And he was saying, well, I can't. Once you raise your voice, my brain scrambles, and I can't hear it. I can't hear it. It's like I'm mentally gone. My brain shut down. And that's valid. Well, sometimes it's an excuse, but very often it's valid. It's valid, and it's a mentally going away and brain shutting down, and information can't be processed. So you might hear someone speak at you, and it sounds like wow, 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 but you can't process what they're saying. You can't take it in. Frankly, that happens, very often happens too when people have to do math. They draw this mental blank or like a mental freeze. Or for me, that happens with technology a lot. But behind that mentally going away or that brain freeze is a traumatic experience. And some traumatic experiences, they're not that huge. For instance, Francine Shapiro, who developed EMDR, called it big traumas and small traumas, if I quote that correctly. But the small traumas, such as the mental freeze when we deal with math, well, it might not sound as bad. Maybe we just went through a math problem, couldn't solve it. We got a fail, and the parent was irritable with us, and we felt really bad, and we decided, or formed a limiting belief: I can't do this. I'm too stupid. Like I'm incapable. And so that was traumatic, and a belief stuck. there. And so every time you see a math problem, in my case technology, you have this mental freeze, or in an argument, or anything that is connected to an event in the past. But it is a sign of trauma. And again, a mass trauma is relatively harmless, you'd think. But when you have to do your taxes or deal with a mortgage and you get brain freeze once you have to look at numbers, then it's not funny anymore. And there's nothing wrong with you, but something scary happened that made you believe you can't ever learn this and you're stupid. I still feel the same way about my cell phone. And I will literally work through that with an emdr therapist. And then the brain freeze, when it's worked through, would stop. And then what else do I have? Going numb emotionally. Sometimes we're in response to something scary, or just very often. And by going numb, I really mean like feeling nothing. Feeling numb, feeling frozen. That's a sign of trauma. It can be a sign of depression. But then it's more like dulled feelings. You can't feel much, or it's a down feeling of depression, of I don't care about anything anymore. I feel kind of I don't feel much. I can't be bothered to get out of bed or brush my teeth. It has this down feeling. Dissociation doesn't necessarily have that. It just has this going away feeling, this blink feeling. There are no more feelings. If you get cut in your finger, you're like, whatever, because you're not quite there. That's a sign of trauma. Something happened to you, and you learned that going away mentally or emotionally, or even detaching from your body in some way, was a really good way of surviving the traumatic experience, and then you're very likely to continue doing that more often. Another difficult to spot sign of trauma is difficulty connecting to feelings. So here I'm going to use a client example. We were working with learning to connect to feelings. Because the person didn't have parenting that helped them learn to feel feelings or label them or sit with them and decide which feelings are scary or problematic, or they just learn to avoid them, or certain feelings are just very, very hard to feel, and the person might draw up mental blanks such as sadness or frustration. That I see that very often in my male clients. Right now, 50% of my clients are sexually abused men. So I am working a lot with men. But this difficulty connecting to feelings, I also see that in women. I also see that in the LGBTQ community. I'm not excluding anyone, but just having difficulty accessing feelings to a point of just drawing a mental blank, or not being able to really feel it, or sadness. Why would I feel sadness? That's bad. Let's not go there. And really difficult time finding it in your being. So sometimes I work with people to be able to feel all of their feelings. And it's very difficult to unearth them. It's almost like we have to spend time digging them up. But something happened where you learn that it's better not to feel feelings. Because when you were little and you felt fear, or terror, you may have been stuck with it. You didn't have your car keys and your credit card. You couldn't say, parents, if you don't get your act together and you stop screaming at each other, I'm out of here. You didn't have that option. So if you're, if you're going through a difficult feeling like sadness or terror or fear, as an adult, like you might not be able to connect to that feeling, even because you learned early on, like, let's just not go there. Let's just not go there. Let's avoid this feeling. And then that becomes very ingrained, and you might also have then thoughts around it, like I can't handle it. That's just going to pull me down. I can't handle it. Because as a child, you may not have been able to handle it because you needed the support of an adult. And so you distance yourself from your feelings. Today, as an adult, you would be able to handle feeling your feelings. And maybe with professional help. But mental health is being able to sit with all of our feelings and all of our experiences, and being able to sit with them and being present and just experience them. The sadness, the terror, the happiness, all of it, and being able to sit with it and cope with it in a present way, be staying present with them. And so if we don't have that and we can't connect to feelings, there's a reason why that happened. And that's a hidden sign of trauma that clients very often don't recognize. What do we have? Since I'm talking about dissociation, I'm going to go a little bit more into the serious side before I complete this video. Dissociation can be very serious, such as, let's say, an example, not remembering your friends. Imagine it happens to you. People walk up on the street and they tap on your shoulder or they hug you. It's so good to see you. I haven't seen you in such a long time. And you're like, who are you? You must have changed a lot. But that can be a sign for a dissociative disorder, which again is a sign of trauma. And I've been working with clients like that, and they usually have no idea that it's connected to trauma. It just happens, and they can't make sense of it, and they might think they have a bad memory, but they're actually dissociating, and they don't recognize people or even close friends, and it takes a while before they do. If you're experiencing that, please seek professional help. Or if you're not recognizing yourself in the mirror. So you look in the mirror and you think, who the hell is that? Actually, that happens to me in the morning when my face is scrunched up and I think, why? Who is that really? I don't know you. I don't want to wash you. But it's not the kind of aging. It's the kind where you look in the mirror and you think, wow, I look like I'm in my 20s, or I'm much older, and you're really confused about it. That can indicate a dissociative disorder that's more serious. It needs treatment, and it's a sign of trauma. And I'm going to quickly, before your patience expires, if it hasn't yet, give you another example. Not remembering running up credit cards or purchases. Imagine eBay packages arriving at your house and you're like, well, they must be for the neighbor, or must be a mistake. And they have your name on it and you have no recollection you did it. Or you see charges on your credit card and you think it's constantly fraud. You call in and you find out actually you made these purchases and you have no idea. These are the more serious dissociative disorders, and they are signs of trauma. If you see anything like that in yourself, please go and get professional help, because you deserve to have a good life and to thrive and not just survive. If you stuck with me for the whole video, thank you. I hope this was helpful to you. And please know that you matter. at all times.